Welcome to Russell Regional Hospital's Health Shift. March is Colorectal Cancer Awareness Month, and myself, Chastity Thacker, and
Jordan Rohr.
are both employees here at the hospital. I work in the respiratory department.
I work on the acute care floor.
And we would kind of like to tell our stories and talk to you guys a little bit about colorectal cancer awareness. In February of 2023, I was diagnosed with rectal cancer. I had some very vague symptoms, some rectal bleeding, and I had put it off for quite some time, kind of thinking that maybe I just had some hemorrhoids. And I decided to get my hemorrhoids taken care of. And prior to that, I had a colonoscopy screening because of the rectal bleeding, and I found out that I had a rectal mass. And since that time, I have undergone 8 rounds of chemotherapy and a lower anterior resection surgery with a temporary ileostomy and reversal surgery. And it has been a very, very difficult path. Colorectal screenings are not generally recommended until the age of 45. I was 42 at diagnosis. It is becoming more and more prominent in early onset. Colorectal cancer is becoming more prominent in early age settings. So I just want to kind of talk to you guys a little bit about symptoms and tell you how you can get screened. If you notice any changes in your bowel habits, for instance, if your stool suddenly becomes thin or you're having a lot of diarrhea, abdominal cramping, unexplained weight loss, any type of bleeding, brown or bright red, I encourage you to speak with your primary care physicians and get screened because you're never too young. It's definitely been a journey. I'm still in the process of the monitoring phase. And I just think that it's very important to pay attention to your bodies. And in March, we like to bring awareness to colorectal cancer because it's Colorectal Cancer Awareness Month. Here at the hospital, we've had, we're kind of like a big family, and definitely this diagnosis has impacted myself and Jordan and some other coworkers tremendously. And it's just very, very important for you to pay attention to your body and go get that screening if you think that you're having any type of symptoms. We have 2 physicians here at the hospital that perform colonoscopies. Dr. Stiles and Dr. Summers both do colonoscopies right here at the hospital. Generally, the wait time isn't very long to get on the schedule to get a colonoscopy done. And definitely, if you're of age, please go get those annual things done you need done, your mammos, your colonoscopies. 45 is the recommended age to start getting colonoscopies. And if you have a familial history, anybody in your family that has had been impacted by colorectal cancer, you are encouraged to get screened 10 years prior to that person's diagnosis.
I'm here to speak on behalf of my mother, who has recently passed away this November. So her journey began, I would say, in 2017. She started having what she thought was IBS type of symptoms, kind of sweating, cramping, intolerance of certain foods. So she had a lot of diarrhea. She kind of put it off thinking that's what it was. She went and got checked at the clinic. They were coming to the conclusion it was possibly her gallbladder. And therefore she was supposed to have some more scans and testing done. Well, that winter of 2020, she actually had this horrific pain in her abdomen, thought she maybe pulled a muscle, came into the Russell ER, and they found that her appendix had actually ruptured. They weren't sure why. She didn't have appendicitis. Her white blood cell count really wasn't that elevated. They were trying to rule out pancreatitis. That came back negative. From then on, during her surgery in Hoisington with Dr. Stiles, they actually tried to not have to go completely into her abdomen to repair the site, but Dr. Stiles was unable to kind of get around a certain area. Well, later on, they sent the tissue in for testing, and it came back that she did have colorectal cancer, and the mass was so large that it had a buildup of pressure that actually ruptured her appendix. So I found out this lovely news around my 22nd birthday. So it was a pretty hard year. My mom did, I think, 10 rounds of chemo. She missed my bachelorette party, but she was getting better. After the chemo, she got back to exercising, working out, doing everything she loved to do. She went to the lake. The year of 2022 was phenomenal for us. I was married, and she got to live her life. And then that next winter again, she got really sick. She had another reoccurrence. And after that surgery, it took her 2 months before they could get her in, and she just got very, very sick. And ended up in the ICU at St. Francis Ascension in Wichita, and she got better there. She fought very hard and then made it back home, continued going through cancer treatments, checking her CEA, any MRIs and PET scans that needed to be done, and she continued to go through the chemo until she was unable to really eat or drink without having irregular bowel movements, and then constipation, and then bowel obstructions, and it just took a toll on her, but she lost her battle, like I said, this last November. So another symptom she had that was pretty out of the norm was her intolerance for alcohol. We noticed that start. She wasn't a heavy drinker. She had an occasional drink here or there for special events, and once the cancer was gone, she was actually able to enjoy a drink, especially out at the lake. And then when her intolerance came back, was a big indication that we became concerned about her health again. So thank you for letting me be a part of this.
And I think on behalf of Candy and her family and myself, if we can encourage and save even one person just by making yourself go get that screening. Colonoscopies kind of had a stigma attached to them just because of what they are. But honestly, the prep is the hardest part. There is no pain associated with a colonoscopy. And I know Candy would be very proud of you, Jordan. And I think on behalf of the family here at Russell Regional Hospital, we just encourage you to please, please go get your screenings done. Thank you for allowing us to talk to you.